Right, so today we are going to talk about deep tissue tools. So once you've complete your Swedish massage training, you have now learned to use your hands in many different ways. So you can use your palm, you can use your heel of hand, you can use your soft fists, which are this area here between your two knuckles. All right, this is your MP joint and your hips. So you're able to use that area. You can use your forearm, normally the area from the closest to your olecranon, which we know here is a landmark, which some people call the elbow, but this fatty piece or portion of your forearm you can use to apply your strokes. All of those strokes you can use, all of those tools you can use when you're performing your clinical massage or deep tissue massage. However, how you use it is what's very important. So how we use them is based on some principles. So what you may remember or hear us as instructors, or you might watch some videos and you'll hear some things that will always be said as relates to performing your massage deeply, or the deeper, more clinical focused work. So you will hear a phrase that says you should work superficial to deep. You should use your tools broad to specific. You're going to work slower. This is going to give you an opportunity to palpate and feel what's happening in the tissues. When we think about those tools that we just mentioned, those tools are, I'm going to give them to you here. So we said that your palm of your hand. Correct? We also said that you can use your heel of your hand. In addition to the heel of the hand, you can use your soft fist. The other tool that we've seen used a lot would be the forearm. Now I'm going to add some new ones in that you may have used or may not have used, but you could use your owner side of your hand. So that's using this side, the pinky side of your hand. So the owner side of your hand. You can also use your fingers. When we talk about the fingers, we talk about them as 3 fingers, which would be one hand, or 6 fingers, which would be 2 hands. What else can we use? We can use our knuckles. We don't use these often, but they can be used. And we can use our elbow, which would be that olecranon. Okay, so these are, again, not all of the tools, but these are some of the more common tools that you'll see used. You will see some of these grouped together at times. For example, all of the hand items you might see together. So you'll see hand, then you'll see palm, heel, owner side of hand. And then you'll have your soft fist and your knuckles grouped together. But what we're doing, and I remember the other thing, what we're doing is we want to peel the onion when we're performing our deep tissue work. So when we're peeling the onion, that means that we want to work superficial to deep. We want to work the top layers first, and then we want to get those nice and soft and limber and ready and prepared for you to sink into the deeper tissues and get to the deeper muscles. So peeling the onion. So how we do that is by applying these 2 principles. Again, superficial to deep and broad to specific. So now, how do we do that? We look at our tools and we put them in the order that they should be. So what would be our most superficial tool would be those things that are going to cover larger areas of the body when you're working, right? So a forearm, you can work deeply with it, but it's superficial. You can give some deep pressure, but it is a superficial tool. Most often, it's not going to go in and allow you to focus and work deep in some tissue or a muscle. Palm of the hand. Again, that'll be your full hand. Those are considered superficial tools. You will use those to work your larger areas and the top surfaces of the body or of the tissues. Then you want to, as you work those and those layers soften, now you're going to move to a more specific tool, not the most specific, but a more specific tool. So in our list, what we have that might be a little more specific would be a soft fist, maybe even your heel of hand. So after you've done work in an area with your forearm and your palm, then you may switch to a deeper tool, which would be maybe a soft fist or heel of hand to get to that next layer of muscle. If you need to go even deeper, you would now move to a more specific tool than the soft fist and the heel of hand. So what we have here could be our ulnar side of the hand. The ulnar side of the hand is a very specific tool that you're going to use for areas that might be very bony and for muscles that you want to sculpt. So you're going to be able to take this side of the hand and really get around tissue. So if you're looking here, Mr. Bones here, one of the common areas you'll see people use the heel of the hand is right here on this medial border of the scapula. You'll take that heel of hand and you can work all in there. You can get all up inside that with that, I'm sorry, not heel, ulnar side of the hand, right up in there. You can even come in to your lateral border and get some of your muscles here, which will be your subscapularis, your serratus anterior. You'll be able to sculpt and kind of break up things that are in that area. Ulnar side of the hand is also an excellent tool to do friction. So you will see that used a lot for that. Ulnar side of the hand. Next, we can go in. These next ones are all kind of similar. Depends on the therapist, because we all have different anatomy, just like our clients. My knuckles may not be as pointy or specific as someone else's knuckles. Same thing with your fingers, elbows, and thumbs. So although you will see the elbow as like the deepest tool, it really depends on the therapist. So all of those would be your more specific tools. Once you find an area that's deep that you need to get in, a lot of times you aren't going to do long strokes with these deeper tools. Again, the fingers, and I'm going to put thumb. Even though we don't encourage you to use a lot of your thumbs, there are opportunities to use it, especially when you're doing static pressure, holding pressure in one area for a period of time. Knuckles, again, depending on the person, could be more broad than the fingers or thumbs or specific. So you would have to gauge for your anatomy. And then last but not least, the elbow. And again, with that elbow, we're going to come in with this electronine process here and be able to apply pressure directly into the tissue. Normally, you've gone through all of your tools that you're going to use. You've peeled the onion. You've worked from superficial to deep. And now you're going to use your most specific tool to address a very deep muscle that might even be right along the bone or close to the bone. So again, this is just a quick overview of your deep tissue tools and how you might apply them in a deep tissue or clinical massage session.